Move this way. So now that the class of 2020 has left, we have officially got the technology working. So welcome back to a session where we're going to learn a little bit about public health and also the history of public health and previous flu epidemics or pandemics. And so, Kathy, I'll turn it over to you. And if you want to introduce yourself, and then you can just dive right in.
Okay. Well, first of all, I'd like to thank you for inviting me and say that I love your state. I've been to Jackson Hole, and I've been to several of the parks. I've been in Yellowstone with snowmobiling, and I've been in those little red vintage trucks to tours. You have a beautiful state, so thank you. What I'd like to do is concentrate a little bit on the history and what we've learned from the history. And one of the things I did as public health nurse is concentrated a lot of my time on tuberculosis. And I found that the public health model and the landmark tuberculosis study that actually developed a way to prevent the disease occurred actually in the town I lived in, Framingham, Massachusetts. So I did some research and found that in 1918, before the flu hit, they had already started to develop a public health model in the town of Framingham to reduce tuberculosis and try to reduce the death rate and the incidence of the disease. Now, given that tuberculosis was very infectious and an airborne disease, much like we're seeing with the flu and coronavirus, there's a lot of lessons that we can learn from this. So one of the things that happened is the year before the flu hit, everybody in Framingham had a physical, and people were very informed about what to do to prevent illness and to prevent transmission of airborne diseases. The other thing is we had a pretty strong model in place. So the minute the flu hit, they shut everything down in the town. So the schools were closed, the dance halls and everything, and gatherings were reduced. And so that really helped to eliminate and diminish the transmission of the flu at that time. Because at the time, the hospitals were overwhelmed and people had to wait to get to a hospital that was really sick. A lot of people were treated at home back then. Doctors and nurses visited the residents, informed them of how to protect themselves and how to treat themselves. The other thing that was important during that time is news went out. We didn't have social media, we had newspapers, but there was frequent updates in the newspapers to the residents on how to protect themselves. So you saw things like cover your cough and sneeze, which we're seeing again today, avoid crowds, open windows, walk to work rather than use crowded public transportation, which again, we're talking about in similar things today. So I guess the message is, what have we learned in 1918 that we're still using today? And the fact that as much as it's a challenge, we've been through this challenge before, and we will survive, and we'll learn a lot from it. We'll develop new models as a result of it. So why were we able to reduce the death rate in Framingham? And also our lockdown period was pretty short, considering it started in September and it ended in December. So we were pretty much over the flu, I think possibly because it went through like a wildfire, but why? So people were told that were sick to stay home. There was close monitoring of the outbreak because we had this model in place. All the nurses visited every resident, instructed them on how to protect themselves. We had an early ban to shut things down. And there were constant updates in the news to inform people as to what was going on, when, and why. The other thing is the community was mobilized in the midst of all of this. A lot of the women actually prepared food for the hospitals because they were overwhelmed. They ran out of bedding and people volunteered and brought their own bedding into the hospital. Various things like that went on. Much like we're seeing today where all of a sudden everybody's making masks, right? So now let's move to Wyoming and see what was going on then in 1918. And they also were shutting everything down. Public activities were curtailed because they knew that that really helped to transmit. Public gatherings, private gatherings, schools were closed. The schools were closed the entire school year from the fall of 1918 to the summer of 1919. And the sick were isolated. They actually, hospitals were so overwhelmed, they had to use the local hotel as a Red Cross hospital. They sterilized utensils that people were in touch with, and some residents began to wear masks in Wyoming.
Kathy, can I ask where the Wyman Hotel was located?
Yes, it's from the Wyoming History.
I'm not, do you know what town that's in, Emmy, or?
I don't. I think it would something, I want to say Cheyenne, but I.
Okay. Yeah, just curious.
The other thing is that some areas it was a law. You had to wear a mask. San Francisco is one. And you can see they're playing baseball, they have masks, and all the attendants have masks as well. So masks have been used in the past. It's not new, it's something that went on back then. The businesses had some difficulty, and like today, they had to restrict the number of people coming in Cheyenne. So they had 5 customers at a time. And the theaters and churches, when they did finally open up, they had scattered seating where people were at, where there were empty seats per person. And that's pretty much it. Again, we're talking about doing the same sort of things today. So what do we do today? Well, one of the things about the coronavirus, there are no guarantees. Young people can get very, very sick. And some of them are left with a disability where they're losing lung capacity. And some people, they're infectious and they don't know, and they're not even sick. So that makes it very difficult in trying to contain transmission. But what can we do? What we can do is concentrate on diminishing transmission of something that's very infectious. So you want everybody that's sick to stay home when they're infectious. And it does vary. You have to really contact your doctor because some people are sick longer than others. And the contacts, the sooner you find the contacts, the easier it is to control the outbreak because you can get them to stay home before they get sick and then begin to transmit the disease. We're again telling everybody to cover your cough and sneeze, much like we did in 1918. Wash your hands, everything you touch, it's good to wash your hands because people tend to put their hands all over their face and that's how it's transmitted. Social distancing 6 feet away, so if someone is transmitting and you're a distance away, there's less likelihood that you will get sick. Clean surfaces and shared items, because that's another way that people can get the organism on their hands, touch the face, and there we go. There's more wear masks also. The thing to know about the mask is the tighter it is around your face, the better the seal, the less likely you're going to get transmission of the organism. The other thing to remember is there's less transmission outside than there is inside. So a lot of your activities now are going to be outside, camping, hiking. Your risk outside is greatly diminished. If you're going to be close to people, you still want to wear a mask, but it's a lot easier to control outside than it is inside. The other thing to consider is when someone coughs, the size of the location. So if someone coughs in an elevator, there's going to be a lot of germs per square inch, if you can visualize that. Whereas if someone coughs in a big barn, it dissipates and there's a little less. So if someone coughs on a bus, one of our buses that you have, there can be transmission. As a matter of fact, there was a case in Framingham where this little boy had the coronavirus and he infected the bus driver, everybody on the bus, the school nurse, the teachers. This is just how it goes, okay? It's how it's transmitted. But what you can do not only to clean the surfaces of the bus when people leave, open the windows, because then the air flows through and the germ dissipates. And then follow the instructions of, your public health orders. But remember this, what we typically see is the tip of the iceberg. So you have 10 deaths. About 8% of the population dies from the disease, which means there's another, per person, there's another 92. So with 10 deaths, it's another 920 cases in the community. And they will infect, and these, at least 3 people that they infect will develop the disease, which means while all this is going on, there's another 2,760 getting infected and perhaps. And this is how one of the things we call it is a simmering outbreak. It's kind of under the radar screen, but it's going on in your community. And then it bumps up to, oh, well, we have a lot of cases now and they end up at the hospital. So to protect yourself today, really, it's just concentrate on transmission and do what you can to reduce that. And hopefully life will be somewhat closer to normal rather than just staying in the house. But, so any questions?
I have a question, Kathy. I think sometimes we here in Wyoming think that, we have this rural nature and rural lifestyle, and we just don't have as many people as anywhere, but especially as places like New York City. And so
Yes.
Is there any evidence from 1918 if rural communities had less spread, or is that something that might be relevant today of the rural nature of our lifestyle?
Well, it actually, in 1918, because it was so rural, what they believe happened is the soldiers returned from the war with it, and it spread through the community.
Right.
But regardless of rural, I was at Big Sky, and some of my friends were going to ski this year, and I saw there were 4 cases. But one of the things I remember about Big Sky, and I think it's similar to, Wyoming, in that people sometimes will have more than one job. So they may be working at the hotel part of the day and driving the bus another. So you can see where, even if it's rural, it can spread. The other thing is, I was in Italy when it all blew up skiing. and interesting is that people today, they travel so. So some of my friends that were in Italy were heading for Big Sky. Meanwhile, they shut the ski areas down. But you can see how as rural and separated as we are, there's no such thing today. That it's just so easy and I think when you have an industry where you're bringing people in from all over, you're running that risk, even though you're rural. It's, it's a little safer, but there's no area, I think, that sometimes the rural areas is where the tourists go.
Sure.
Yeah.
Yeah. I did hear, I don't know if this is true, and you may or may not know, but I did hear that in the 1918 flu, a town in Colorado, I think Gunnison, Colorado, blockaded themselves in, that they didn't let people in or out as a precautionary tool.
And I took the slide out and I can send it, but if, you can check the website. But there was a place in Wyoming, they actually, a little town, no one was allowed in. They were told not to come. If they did come, they were quarantined for 3 days. And they were able to control and not have it much of an impact in some of the surrounding areas.
Yeah. What are your thoughts on, go ahead, Emmy.
I was just going to ask, was there as much frustration and aggression towards reopening in 1918 as there is today? Was that, pushed as much, and was this seen as political like it is today?
Yes, well, I think it depends where you were. One of the things about Framingham, I think that was really critically important, is there was one consistent message. So it didn't change. So people really knew what to do. But we had that public health control. But there was a big demonstration in San Francisco against the rights of people that they shouldn't have to wear masks. So yes, there's always been some resistance to, and particularly, I mean, it's concerning if your livelihood is at risk. I think that what they did in 1918 is they shut everything down. I think what we're exploring, and hopefully we might be able to develop new models where maybe we can kind of open it up, keep it a little bit open, but we have to put a new model and new restrictions in. And hopefully, if everybody does what they're asked, we may be able to develop something that can be used in the future even, you know. Otherwise, what happens is, if you can visualize, the organism spreads like a wildfire. And in rural areas sometimes are the last to be hit because they are a little more isolated, but the organism, once it finds this rural area with a lot of susceptible people, it's there. You know, so.
Any thoughts, Kathy, on sort of herd immunity versus a vaccine? How did that play out in 1918? Was it herd immunity was reached and it sort of moved on, or was it waiting for a vaccine?
No, everybody was frightened, very, very frightened of it because there were so many deaths. I mean, they estimate there were 50 million, but it's probably, Dr. Algie Maria believes it was closer to 100. Because, you know, when you have a pandemic, not everything gets recorded. You know, so herd immunity, the dilemma with herd immunity is that what you would get is the healthcare system would get overwhelmed, and it would be unable to withstand the number of people. And there are some instances I've heard in some countries where people are waiting 15 hours to get into the hospital. And there are some instances I heard about in New York where people who called for ambulances had to wait. You know, we expected an ambulance within 10 minutes and only had to wait. And some people were rejected, even though they were pretty severe. They said, well, you know, you're not severe enough and we have so many calls. So that happens. The other thing, it can be extremely disruptive to life itself. If you have big outbreaks in businesses and things like that, and they have to shut things down, that can be, people can panic. And so herd immunity is not necessarily a good idea. I think what it will lead to is more confusion, more fear, and it not necessarily will it solve the issue in the long run. I mean, the vaccine is what we're hoping for.
Yeah, so sort of just buying time to get to the vaccine and keep the healthcare system from being overwhelmed.
In the meantime, the health department are really looking for people that are at risk for developing the disease to isolate them. And that is a better way to stop everything, is find out who are you in. If I had this and I was in contact with you, get you in your house for 14 days. So then it doesn't continue to spread. That is, in Massachusetts, that's the model they're using right now. They're investigating everybody, trying to separate everybody that's sick and everybody that can get sick to try to shut it down that way. I think that's a more effective way to do it.
Yeah. Okay, last question. I know there's a lot of talk today of which of these systems will stick around. You know, like, will we ever go back to shaking hands? And, you know, now we've accustomed ourselves to these virtual meetings. And so maybe will more people work from home? But as I reflect on the 1918 timeframe, and then you sort of had, you know, and hearing you talk about social distancing, closed schools, like masks, and then we hear about the Roaring 20s, where I don't think any of those things were a value or happening. So what are your thoughts on the pendulum swing of, yeah, we'll keep some of these practices, or if it's like, no, we'll probably go the other way just to like reset from our fatigue?
It's kind of interesting. It's kind of interesting. There may be a rebellion, but I think initially, I think people will be very conservative. And I remember hearing my mother, "Don't touch your face." That must have come from the flu.
Sure.
Or go
Yeah.
outside. What are you doing inside? Go outside. So there
Sure.
are a lot of things I think that will stay in place for a period of time, and we'll have to be a little more careful traveling. We might not be able to travel to exotic places for a while, but eventually things will go back, but it will take a while. We had a 1978, we had a terrible, terrible blizzard. It literally shut Massachusetts down for 3 weeks, some areas 2 weeks. And now, when we think we're getting a blizzard, all this time later, everybody stocks up on food because people ran out of food because the grocery stores ran out of food.
Sure.
So things will stay, but they will eventually go back.
Yeah. So interesting. Well, Kathy, thank you. That was really wonderful. And we will share this with our class members and maybe some others.